Sciatica refers to pain felt in the buttock or down the back of the leg as a result of irritation or compression of the sciatic nerve or its nerve roots. As well as pain, other symptoms can include tingling and, in more severe cases, total numbness or even weakness in parts of the leg. The weakness can get so severe that a patient can lose all power to the affected muscle groups to the extent that they lose the ability to put their foot up towards their shin or stand on tiptoes. The sciatic nerve starts around the lower back, passes through the buttock, then down the back of the thigh to the knee, where it divides into two branches which supply the lower leg and foot. Sciatica can originate from damage or pressure on any part of the sciatic nerve, but the nerve is most commonly irritated where it begins in the lower back. In early adulthood to middle age, the most common cause of the irritation in the lower back is from a bulging intervertebral disc. After middle age, it is more likely to be from degenerative changes or osteoarthritic changes of the spine. Other causes include a spondylolisthesis, which is when one vertebral segment of the spine slips forward in relation to the one below. Most of these types of lower back problems can be helped by lifestyle changes and physical therapy, including education on posture and corrective exercises. Most cases do not need surgery, but persistent or severe cases may require spinal surgery to relieve the pressure on the nerve. In the few severe cases where symptoms include severe numbness or weakness in the leg, tingling or numbness around the genitals, or loss of bladder or bowel control, urgent surgery may be required to prevent permanent nerve damage. For isolated disc bulges, some spinal surgeons use microdiscectomy techniques, in which just the bulging part of the disc is removed. The procedure involves the use of a microscope, which enables a smaller incision to be made. This causes less damage to the muscles and soft tissues around the spine, and therefore a quicker recovery than with larger incisions without the use of a microscope. The limitation of microdiscectomy is that access to the spine is limited and the surgeon may not be able to view all of the affected disc. The latest advances in disc surgery involve minimally invasive procedures such as percutaneous disc nucleoplasty, during which a thin needle is inserted into the disc under X-ray guidance. Radio waves are then used to vaporize the bulging portion of the disc. The procedure does not involve any incisions on the back. It can be performed on an outpatient basis and does not involve a general anesthetic. However, these sorts of techniques are relatively new, with little published data on the outcomes, and not widely used in the UK. Occasionally, patients who have sciatic pain will undergo investigations such as MRI scans of their lower back to look for the cause of their sciatica, and a cause will not be identified. There can be various explanations for this. For example, the irritation may be in a part of the sciatic nerve below the lower back that was not imaged in the original scan. An example of this would be piriformis syndrome. Piriformis is the name of a muscle in the buttock. In approximately 10% of people, the sciatic nerve goes directly through the middle of the piriformis muscle. If this muscle goes into spasm or becomes tight or fibrous, this can pinch on the sciatic nerve and produce a form of sciatica. Patients with piriformis syndrome often benefit from a course of manual therapy involving deep massage and acupressure-style techniques to release the tension in the piriformis muscle. With the correct application of such techniques, relief should start to be felt within 1 or 2 sessions, although it may take somewhat longer to resolve the problem totally. Patients will also benefit from stretching their piriformis muscle, which is most easily done by lying on one's back and pulling the knee towards the opposite shoulder. An illustration of this is shown on our website, www.nationalbackpainhelpline.co.uk. Another tip for piriformis syndrome is to sleep on the side with a pillow between the knees. This will help slacken the piriformis muscle and take some pressure off the sciatic nerve. Another explanation for pain that can mimic that of sciatica is referred pain. Possible causes of referred pain include the hip joint, the sacroiliac joints, or small knots called trigger points in the lower back and buttock muscles.